Okay, let's transition now to conversational AI.
Right. This is where AI starts talking back, basically mimicking human dialogue. Our source lays out a kind of spectrum here, from simple chatbots up to more complex AI agents.
Okay, so the basic and simple chatbots. What are they like in healthcare? What can they do? And what are their limits?
Think of those automated helpers you sometimes see on a hospital website. They usually follow pre-written scripts, like a flowchart. In healthcare, they might handle simple FAQs about visiting hours, maybe basic appointment queries. But as the source notes, they're limited. They struggle if you ask something unexpected or go off script.
So pretty rigid. Okay, next step up. Digital assistants. How are they different?
Digital assistants are smarter. They use natural language processing, so they try to understand the intent behind your question, not just keywords. They can also remember the context of the conversation better. In healthcare, this lets them do more, like maybe help doctors with medical transcription or pull info from an electronic health record EHR to answer a question.
That sounds a lot more useful.
Yeah.
And then at the top end, AI agents. What makes them distinct?
AI agents are the most sophisticated. Their key characteristic is their ability to make autonomous decisions and actually take actions for you. They integrate different AI capabilities and can interact with other systems. So in healthcare, maybe an AI agent could automatically update a patient's EHR, schedule follow-ups without needing a human to click confirm, or even monitor vital signs and alert the clinical team if something looks wrong.
Wow, that's a big jump in autonomy and capability. So the progression isn't just about better conversation. It's about understanding, memory, decision-making, and actually doing things independently.
Exactly. Our source has a useful comparison table showing these differences. Conversation flow goes from linear to dynamic to adaptive. Understanding goes from keywords to intent to comprehensive understanding. Memory increases. Decision-making goes from rules to recommendations to autonomous actions. And integration with other systems becomes much deeper with AI agents.
And what about specific healthcare uses for each level? We touched on some.
Yeah, so for simple chatbots, basic FAQs, maybe initial appointment scheduling requests, medication reminders, digital assistants, helping doctors with transcription during visits, EHR navigation support, and AI agents, tackling the complex stuff like coordinating care plans for chronic conditions, remote patient monitoring, proactively alerting clinical teams about potential issues.
It really shows how conversational AI is moving from simple Q&A to potentially playing a much deeper role in how care is delivered and managed.